Welcome to VERVE Trauma Talk. I am Dr. Amar Pyari Makhanlal Chauhan, and this is Season 1, Episode number 2. And let me re-emphasize that my aim is to identify the gaps in the emergency and trauma care and to offer solution. And these are my personal views. Okay, so taking the first episode forward, where I discuss the grim emergency and trauma care scenario in India, let's discuss what is the way forward. And I believe in bottom to top approach rather than top to bottom approach which we are pursuing till now. And again, I will refer to Niti Aayog document, the emergency and injury care at district hospital in India, and I will dissect and discuss that report at more granular level, as it has rightly identified all the problems with plagues Indian EM care, and based upon their finding, which I am not surprised at all, the authors have made certain suggestions as a recommendation. So let's see what it says about pre-hospital care. And before that, I would like to talk about the lack of pan-India emergency care number. And I have failed to understand why the successive government have not done this, on emergent basis. And of course, I understand that health is a state subject, but when national interest is involved, then the directive should come from the center. And I will urge everyone to appeal the government to immediately, on urgent basis, to have this pan-India emergency care number, so that the bystander or the good Samaritan does not hesitate and doesn't get confused when calling for help. Okay, now coming to the recommendation of the authors of that Niti Aayog document, as they have rightly identified that the pre-hospital care is non-existent in India, and they have recommended that we should have a world-class 24/7 pre-hospital care, and that is my problem, the world-class. I don't think we can aim right now, when we have to do a lot of groundwork like world standard or world class, but instead we should have a workable, sustainable, trauma and emergency care system according to Indian setting and culture. And in this aspect, in this context, I would appeal and urge and exhort all our trauma and emergency experts to give us the guidelines, the framework, the blueprint for having this kind of such type of care system. So, what is the present scenario about paramedics? So, this 6-month course of EMT is awfully inadequate. I have personally talked to a few of the EMT, and they are not confident at all in handling emergency situation. Why? Because they were not given any skill or scenario-based, curriculum teaching, and it was more of a didactic teaching, and they were not exposed to field training before they were pushed into the healthcare system. So with those kind of EMT, we are not gaining anything. We are not adding to our capacity. So what is the solution? So my views on this is that we should have a simulation-based EMT training, as the trauma and the emergency care is basically simulation-based teaching and not only theoretical, So we must have simulation lab at state and national level, and they should be taught through skill and scenario, and the instructor or the educator must have some kind of background in simulation education. And before we push them into healthcare system, we should expose them to field training, and we must, and I will re-emphasize on this point, we must change their mindset, their behavior, and their communication skill, because when they go to the hospital to drop a patient, they need to have the right kind of communication. They should be able to convey the patient condition appropriately to the physician or to the triage nurse. And I don't want certainly them to be expert right now. Of course, we have to move from the pre-novice to novice and then expert stage for the EMT. And I would recommend following skill for EMT to possess. Number one, they should be able to identify live threats and should be able to, intervene right kind of treatment. Secondly, they should be able to apply a cervical collar. They should be able to identify a compromised airway. Should be able to do suction, apply oxygen, or should be able to insert an OPA or do a jaw thrust, and most importantly, should do BVM effectively. They should be able to apply a care tourniquet in case of catastrophic hemorrhage, and they should be able to stabilize a fracture by applying a splint or Kramer wire, and they should do high quality CPR. So these are the few skills they must possess before they are pressed into the services. Okay, so once we have trained our EMT, what's next? The next is, what is the scenario at our district hospital? Because if I talk about present scenario, they are acting as a referral center. Why? Because their plea is that a patient of head trauma comes to them and they don't have a neurosurgeon, so they cannot keep the patient in the hospital. If a patient of GI bleed comes, they can't keep the hospital because there's no gastroenterologist. If the patient comes in the dead of night, they can't keep the patient because the cardiologist is not available 24 hours. So at the same time, when we are training our EMT, we must build our resources at the district hospital level also. Then only the training of the EMT will be, successful. So I will appeal the government and all who are concerned with healthcare delivery to have these two developments simultaneously. Now, what about ambulance services in India? As the Niti Aayog document rightly identified, that 90% of the ambulances, they are just acting as transport vehicle. They are just ferrying the patient or the dead bodies, and they don't have life-saving equipments. So it is up to the licensing authority that they ensure that the ambulance should have right kind of equipment and in function condition. And one point I want to raise is that the Suzuki Motor, who is rolling out ambulances, doesn't provide a spine board, and I think they can't do that in Japan. So I will appeal to them also to provide at least a spine board in ambulance. And that's conclude this present episode. I'll be back with a new episode that will be episode number 3, and there I will talk about how we can train our nurses so that our EMT, nurses and physicians are on the same page when they are taking care of a very sick patient. Bye bye. See you next time.